All right. So as I'm looking out over the audience here, I'm seeing a lot of diversity in the kinds of organizations that we're all here to represent. So, which is a really good thing. But we're all coming together today because we have something really big in common. We all want to educate the many different groups that make up Missouri's uninsured population, help them understand the health insurance marketplace, and get them enrolled. So, to that end, we want to have conversations that make it easier for them to understand. We want them to understand the choices that they have. We want them to leave the conversation feeling empowered enough that they actually feel that they can act on the information that they have and get themselves enrolled for health insurance in the marketplace. And it makes sense to today, so we're going to be going through a set of talking points to help make that a little bit easier for you. So in front of you, you have a handout. I'm going to hold this up, handout, which you'll have a chance to read a little bit later. But this is a set of talking points. Also in the back, we have two sets of what we're calling an elevator speech. It's sort of a boiled down version of this bigger talking points document. So first, let's talk about why do we need this? There's several reasons why we need talking points. First of all, they help us to stay consistent. Lots of people are going to be talking about this very big, very complicated law. There's been a lot of misinformation, as we all well know. It's been a very highly politicized issue. So talking points will help us keep our messages consistent no matter which audience we happen to be talking to. They help us prepare and stay on topic. So the Affordable Care Act and the health insurance marketplace are very big issues, but we're not really here to talk about politics. We're here to talk about, what it is, how it can help you, how you can benefit. So to clear up that confusion and educate people, talking points can really help you keep the conversation focused and moving forward and not get mired down in detracted from, political conversations, the do's and don'ts and the pros and cons of Obamacare. Talking points can really help guide your conversation forward. And then they really help you to organize the key points to guide your conversation. So, this is a very long, very complex law. There's any number of ways that you can go. Trying to cover it all just doesn't make sense. So talking points will help walk you through that conversation and really help you hit the key points of what you want our audiences to walk away with. And remember, as you're looking at this document, we'll actually have a little bit of time to practice later. This isn't a script. This is really something to help guide your conversation, but through any communication with these talking points, we're gonna wanna hear your voice. So a couple of tips, moving on. What are the big things that we really want our audiences to take away from this conversation, these conversations that we're having with them? A couple of tips: boil it down to a few key points. Since many of our interactions will be brief, you might be meeting someone, say at a health fair or at a community event. You're not going to be able to cover the whole gamut of everything that we could possibly talk about. So make sure that you think in headlines. What are the big things that you want them to take away from that conversation? Use simple, direct words. Speak plainly. Don't say something more complicated when you could say something simple. Avoid jargon. So a lot of people, we're working day to day in this kind of situation where we're familiar with what a copay is. We're familiar with coinsurance. We talk about the federal poverty level. A lot of people that we're going to be speaking to don't really know what that means. So if sometimes these terms are unavoidable. If you happen to use them, just make sure that you use a clarifying statement to explain what it is. So later today, since this is the first session you'll be in, I should mention you're gonna have a really great opportunity to go through a 20-minute mini session on plain language from our partner Health Literacy Missouri, and they're really, really great about helping you understand how to speak plainly. So for instance, saying medicine instead of medication. It's not something we ordinarily would think about, but it does make a difference. Moving on. I should also mention, in terms of avoiding jargon, on our website there is a very long and lengthy dictionary for people that aren't familiar with these terms. They can go to covermissouri.org and get familiar with them with plain language definitions. So looking at your talking points, you'll notice that there are some sub-bullets under the big bolded headlines. These are supportive details to help you illustrate your point and to help connect it back to your audience. And then finally, we want to personalize our messages for specific audiences but maintain consistency. So I should mention that these talking points that you have in front of you are general talking points, but we will have some resources available for you guys through Dropbox that are personalized to specific audiences, like young adults, rural audiences. You'll have basically the talking points in front of you to be able to kind of connect with those audiences directly and make sure that the messages that they're hearing are very relevant. And we'll also hear from our panel on that in a little bit. Okay, but first let's think about the many different kinds of people that we'll be talking to about the marketplace over the course of this campaign. So everyone has a different story to tell, and you'll meet people with varying levels of understanding about the law. Some people may think that they understand the law very well, but are very misinformed. And other people have different priorities when it comes to health insurance. A young adult might not be as concerned or think that they need health insurance, but by law they're required to have it. Other people have had, difficulties with obtaining health insurance in the past due to pre-existing conditions. So you're going to meet a variety of people as we're talking about this law. So, that's just something to think about as you're heading into any kind of communication situation. These talking points are not a one-size-fits-all, but they're a guide to help you personalize to your specific audience. So keeping this in mind as you are tailoring to a specific audience, it's still very critical for each of the messages to be very consistent. There's a lot of us talking about this law. There's a lot of misinformation. So, the more consistent that we can be using these talking points as a guide, the less information that we'll have, the more, these messages will tend to circulate, and people will be getting the real info. All right, so taking a look at your handout, you'll see that the talking points are kind of categorized into 3 big buckets. So this will help you organize the points in your head as you're speaking to people and really stay focused on the information that you want to provide. So 3 big things that we want to talk about, what kind of questions we'll want to answer with each category. Number 1, kind of starting off that conversation addressing what the health law is about, what is it, what's required. Moving on to sort of the meat of the conversation about the Missouri health insurance marketplace, answering questions like what is it, what can you do there, and who can use it. And then finally, a really big category is financial help for buying insurance, answering questions like what kind of help is available, who can get help, and how do you get it. And notice I say financial help rather than financial assistance. That's one of those plain language things. Assistance, we're dealing with different levels of literacy as well with the people that we're communicating. So just using a simple word like help rather than assistance is the kind of thing that you're going to need to think through. Okay, so getting into sort of the meat of the talking points, starting off this conversation with an introduction about the health law. I mean, you might be talking to people in any number of situations. So at a health fair, a community event, or a small group gathering, how do we start this conversation? It might make sense to kick it off with a question. Did you know there are new rules to protect you and make sure that your health insurance is there when you need it? One of the rules you may have heard about is that most Americans will be required to have health insurance by January 2014. If you don't have insurance, you may pay a penalty. So you notice this is pretty simple. There's only a couple of points here, and that's for a very specific reason. We want to definitely address the health law. We want to, kind of talk about the big key tenets of it. There's new rules. Health insurance will be there when you need it. Most Americans will be required to have health insurance. We kind of want to hit these and then move on to the meat of the conversation, because it's very easy at this point in the onset of the conversation to get detracted, because we really don't want to go down that road of the pros and cons of the health law. That's not what we're here to talk about. We're really here to talk about the marketplace, why it's beneficial, and how it can really help people. All right, so getting into the real, the real big part of the conversation is about the health insurance marketplace. So you see here, we've got sort of the big points. This is kind of a lot. There are 4 points here, but we've got like the big points highlighted in yellow. So if you can't get affordable health insurance from work, you can buy it through the Missouri Health Insurance Marketplace. The marketplace is a website where you and your family can compare and buy insurance plans that fit your budget and healthcare needs. This is all very simple language. There are 4 kinds of plans sold in the marketplace, sorted into groups based on how the cost of healthcare is split between you and the insurance company. And the 4 groups are bronze, silver, gold, and platinum. All health plans in the marketplace cover the same set of essential health benefits, which I should mention here, essential health benefits is not a term that a lot of people will be familiar with. So that's the kind of thing where you would need to explain. Essential health benefits are 10 kinds of services that include things like doctor visits, care in a hospital, and prescription medicines. So you see here that we're really boiling it down into the simple points again, but right now we're thinking in headlines. So finally, as I mentioned, a key category to focus on, especially for many of the audiences that we're going to be speaking with, is financial help. The big key takeaways here: financial help is available if you can't afford to buy health insurance through a new tax credit, which lowers your monthly premium, cost sharing reductions that lower your out-of-pocket costs. Signing up is easy. It just takes 1 application. And there's help if you have questions. You can go to covermissouri.org or you can call this number. I should also mention to you, available on covermissouri.org, which you'll probably hear about during the demonstration of the website, we will have a zip code locator where people will be able to actually go enter their zip code and find someone that they can speak to in person if they need help. All right, so here comes the fun part. We are going to practice with a partner. So if you guys would first of all take a couple of minutes to review this document, get the talking points in your head. Just for the purposes of this exercise, it might be easy to look at the elevator speech because that's basically timed at about 30 seconds. So you can use this as a tool if you're out and about and you want to kind of give a very quick spiel on the Missouri Health Insurance Marketplace. We have one tailored for an individual or family audience. We also have another one tailored for small businesses. So just get familiar with that, and then we'll pair off. We'll give you a couple of scenarios. We'll practice. One of you will play the role that's listed in the scenario, and then the other person you'll act as yourself. And then we'll switch, do a second scenario, and then we'll get back together and kind of talk about it a little bit. So the first scenario, one of you will play yourself, the other person will play a mom. So you're at a community event and you're approached by a mom who doesn't have insurance and has never heard of the health insurance marketplace. She doesn't know much about the rules of the law or what's required of her. So we're going to give you 3 minutes to participate or practice in this scenario, and then we'll switch over to a second scenario, and then we'll debrief. Go. It's hard to have a conversation about this in 3 minutes, isn't it? All right, we're going to try a second scenario, and then we're going to talk a little bit about the talking points and how they help guide our conversation. All right. There we go. So in the second scenario, we're going to switch roles. One will be the actor, one will be playing yourself. So you're at the same community event, and you're approached by a 26-year-old young professional who works for a small startup. His company doesn't offer insurance, and he hasn't purchased it. He knows he needs to follow the law, but he doesn't really know where to start, and you're there to help him. So go forward. All right, so obviously there's a lot to talk about when it comes to the health insurance marketplace. So just thinking back to these 2 scenarios, I'd like to hear from you guys about the talking points, and did they help guide your conversations in both of these different scenarios? Any specific thoughts? You guys are quiet. Yeah.
Can you educate me on the most American
Yeah, so we have here the most, the talking point about most Americans will be required to have health insurance. So we'll actually have this in another set of talking points. For the purposes of today, we have general talking points that are pretty high level, and you'll also be able to find this information on our website, covermissouri.org. So there are exemptions for the law that will be listed out. I mean, things like you're a member of a tribal, a federally recognized Indian tribe, you're a part of a specific religion that prohibits you from having health insurance. Those kinds of exemptions you will have in front of you through other talking points that we'll be providing to you through Dropbox. The information is also available on our website. Sure. Any other questions so far? Thoughts on talking points? Sure. That's not a question I can answer. But that does bring up a good point. I think you're going to be talking to people who Medicaid is obviously an issue in Missouri, and talking to people who could have qualified. We will have language for you to be able to handle those kinds of situations available in Dropbox as well.
For those folks that can't get on a computer, what other options will there be?
So that's one of the talking points. The help is available if you need it. So for those that can, you can go to covermissouri.org, obviously. But for those who don't have access to the internet or a computer, there's a phone number that they can call. There's two different numbers I should mention. There's one for the health insurance marketplace for individuals and families. There's a different number for small businesses and nonprofits that are needing help as well, to call to talk about SHOP. So there's a phone number. In addition, there will also be, I know on our website, there will be a zip code locator. There will be people strategically placed over the state that people can talk to in person as well.
This customer service number that you gave us?
Yeah, they should be able to access those people. Yes. Hi. That's a good question. I don't know if you guys know off the hand. I believe that you can. But that's a good question. I can't confirm specifically, but I believe that you can. I know that you can do it definitely in person and online. Via phone is a question. Yes?
Is the website going to be translated, and how soon?
Yeah, that's a great point. So you'll have a mini session later to go through all of the materials on the website and everything, but the question was if any of the materials or the tools will be translated. The answer is yes. We don't have the final list of languages that it will be translated into, but there will be non-English materials, and that will be very clearly noted on the website homepage. It will take people to the materials that we have as well. So a lot of the fact sheets, things like that, will be available. All right. So I think we're at time. I'm going to walk through very quickly. We've already kind of covered off on tools. Just a matter of using tools in any of your communications with the people that you're speaking with. It's very important, like after or even during your conversations, you'll have the opportunity to reinforce your talking points with materials. And if you haven't seen all of the boxes outside, we have a lot of materials. We have, I believe, 25 different items that you can use to communicate and reinforce what you're saying to the audiences you're speaking with. So if you don't have materials, if you haven't ordered them, stop by the table. We can definitely send you home with some. It's a very good opportunity to either during the conversation, reinforce and kind of point key points out on a fact sheet, or definitely after the conversation, make sure that you're not sending them away empty-handed. Make sure that they have something to take home with them and review, just so those points are reinforced and that they stick. In addition to that, a lot of people, get their healthcare information from friends and family, so equip them to help spread that message and maintain the consistency of the message through the materials that we've put together. So ask if they want additional copies for friends or family that they could share. All right, and I'm not really going to go through each of these since we'll have a mini session on all the materials that we've put together for you, but we do have core materials like talking points, FAQ. We'll have social media calendars available to you on Dropbox. We have printed handouts, like I said, available today. We'll also working on some additional materials to help support you, like newsletter articles, presentation, some print PSAs if you're looking to get the word out through local media in your market. We'll have a PSA available to place. And all of these materials will be, actually some of the materials will be available on covermissouri.org. There's 2 sections. There's a tools section, and there's also materials available in the coalition section of the website. You'll learn more about that later. And then in addition, we'll have all these materials available via Dropbox. Yeah, so if you haven't already, I can give you my card and we can connect you with that. But we have a tool called Dropbox, which is basically an online community folder where anybody that's given access has access to the materials within it. So it's basically a community folder where you can go in. If I can see this, I can put materials into it. You can access them from a different computer. You can download an application on a phone so you can access materials that way. So that's basically a way that we are trying. It's sort of a clearinghouse of information that we're using for everybody. It's, kind of a good way to aggregate materials. So I can give you my card and we can connect on that later if you don't have access. All right. So now I'm going to, I'm sorry, there's another question.
Thanks. I just wondered, are there any restrictions on who can help an individual go through the process?
Go through the process of enrolling? That's a good question. I know there are 2 different kinds, and this might not be a full answer to your question, but to my knowledge, in any of our panel, if you're better educated than I, feel free to answer this as well. But there are going to be 2 kinds of people that can help people apply. There will be a navigator, what's called a navigator, and that's a counselor that's funded by the federal government, or a certified application counselor, which is basically the same role. They're just funded a little bit differently. They'll also be one of those in-person people that can help people go through the process. In addition, I believe that agents and brokers can help people enroll, but anybody that is serving as a navigator or a certified application counselor, they have a strict set, they have to go through training, they have a strict set of standards that they have to adhere to. They must remain unbiased. Others are not necessarily held to that standard.
So the rest of the people basically just say go to this website or call this number?
Yeah, so if you're in a communication situation, the question was, what do we do? Do we send, if we're not, qualified to help people go through the process, what do we do there? You might get questions from people as you're out, interfacing with people in the community at events and things like that. Can you help me enroll? Certainly if you're not comfortable with that, or if you're not qualified to do that, you shouldn't feel pressured to do that. But this is why we have these materials put together, is to help direct people to the right resources. So, always feel comfortable referring people to covermissouri.org. Always feel comfortable referring people to that 1-800 number, which is run by the federal government. They'll be able to reach a person to speak to. Or they can go on covermissouri.org and use the zip code locator to find someone in person that they can go and sit down with, and they can help them through the process. So definitely don't feel pressured to step outside your role if you're not comfortable with that. But we do have the resources to help get them to the right resource. Any other questions before we move on to the panel? All right. Well, right now I'm going to hand it over to Brian Smith from the Missouri Rural Crisis Center, who will be speaking to you about communicating with that particular audience.
All right, good morning. Can everyone hear me okay? All right. Let me get this up here a little bit. Okay, I'm Brian Smith. I'm the rural organizer with the Missouri Rural Crisis Center. We're based here in Columbia, Missouri. We're a nonprofit, member-based statewide farm and rural organization. Established back in 1985 in response to the farm foreclosure crisis, and since then, we've developed our mission, which is to preserve family farms, promote stewardship of the land and environmental integrity, strive for economic and social justice for rural communities by building unity and mutual understanding among diverse groups, both rural and urban. And we're also fighting hard on rural health care to establish access to affordable and adequate health care in rural Missouri. Because there's definitely a crisis going on there that could possibly get a lot worse. And so we also operate 8 food co-ops in 8 different economically depressed areas in the state. Now, our main targets, of course, are farmers and rural citizens. And in fact, 82% of our members reside in rural counties, with our highest member densities in northern and central Missouri. Now, we directly communicate with over 5,600 members and indirectly with thousands of rural Missourians across the state. Rural Missourians tend to be older, have lower incomes, and have less access to work-based health insurance and also high-speed internet. Now, we found through internal surveys that 70% of our existing members either don't use the internet at all or don't use it on a regular basis. And the average rural farmer gets most of his or her information from farm magazines, which oftentimes come in the mail, also farm radio, as well as local newspapers and direct mail. Now, due to these factors, we use multifaceted campaigns to reach, educate, and activate rural Missourians. We use very targeting techniques, either by county or other geographical subdivision. On issues, we have certain members that are very passionate on farm and agricultural issues. We have other members who are more passionate about healthcare, and so obviously depending on the issue, we tend to target those members that's their highest interest level. We also target by political district. If whether it's on federal farm policy, if there's a certain congressperson or senator that we want to get a message to, and also at the state level with state senate districts, state rep districts, depending on what committees they're on, what issues are up, we target that way as well. Now, we employ phone banking, email action alerts, public educational meetings, lobby days, letters to the editor, direct mail, paid, and earned media. Now, the email action alerts, that might sound counterintuitive given the stat I just gave you, but they are extremely effective with the 30% of our membership that do use the internet on a regular basis. Now, our most successful campaigns are achieved when we use 2 or more of those above methods that I outlined for you. It's been our experience that to use strictly paid media is not a successful strategy. Now, we've seen that events like public meetings, whether it's educational or an in-district meeting with a legislator, and also lobby days at the Capitol, bringing members down to talk with their legislators about a particular issue, are very successful because obviously it directly involves the members, it builds their collective confidence, and also does a great job of developing leaders, because even within that group, certain people tend to step up and really engage productively with the legislators, and that helps grow the organization and also make us a lot more effective than simply staff having to take the lead on all of these matters. And so that's how that's our audience, that's how we target them, and that's how we've found to greatest effect to reach them. Thank you. And, I'm sorry. And now I'm going to bring up Joel Jackson from BJC.
Good morning. There you go. Let's try again. Good morning. Thank you. So my name is Joel Jackson. I'm program manager with the Center for Diversity and Cultural Competence at Barnes Jewish Hospital in St. Louis, Missouri. Instead of telling you perhaps a lot about my organization, I'm going to tell you the things that I've learned working in healthcare and social justice for the past 11, 12 years or so. My previous work involved targeting specific communities and doing outreach within those specific communities, whereas my current work mainly involves working with the staff at the hospital to better communicate with the populations that we serve. So the things that I've learned combining both experiences of the past 2 organizations that I've worked with. First, it's important, especially when trying to serve marginalized communities or trying to reach marginalized communities, to start with self-awareness, okay? Sometimes there's a tendency to want to focus on the other group. What is it that I need to know about the lesbian, gay, bisexual, transgender community? What is it that I need to know about the African American community or other populations in order to better serve that community? Well, it's more important to first focus on self-awareness. What is it that I already think I know about these communities? What have I learned? What have my parents taught me? What have my grandparents taught me? What did I learn in education? What does the media tell me? When I listen to the news, when I listen to music, how does that influence the way that I interact with those who are similar to me and the way that I interact with those who are different from me? okay? Because it's important to keep in mind worldview perspective. The fact that all of us have our own way of viewing and seeing the world, which means that every interaction is a cross-cultural interaction. You look at me, you can see I'm African American. I also self-disclose that I identify as a gay man. I also told you that I'm program manager at the Center for Diversity and Cultural Competence at Barnes-Jewish Hospital. Worldview teaches me that even if I interact with another African-American gay man who's a program manager at Barnes-Jewish Hospital, it's still a cross-cultural interaction. So I need to have the critical thinking skills to know that even if I've learned the top 10 things to know about an African American, or the top 10 things to know about the LGBT community, or the top 10 things to know about someone who's trying to help cover Missouri for insurance, all of those things may not apply to those groups of people, okay? So critical thinking skills are very important. So at Barnes-Jewish Hospital, one of the things that we focus on is communication on cross-cultural differences, keeping in mind worldview perspective. 60% of our income at Barnes-Jewish Hospital comes from Medicaid and Medicare. It's important for our team members to understand that. 50% of the St. Louis city is African American. And if you're familiar with St. Louis and where Barnes-Jewish Hospital is located, it's actually located at the center of the city. And it is the only hospital, well, I should say there are no other hospitals north of Barnes-Jewish Hospital. So all of the residents who hear about the services of BJC and everything, they have to travel quite far just to reach a hospital that's close to them, and Barnes-Jewish Hospital might be the closest one. So it's important for team members to understand that we are serving a diverse population, and we need to have sort of a universal precautions with serving serving everybody within the population. Another thing, 5% of the patients that come into our hospital are limited English proficient or are from immigrant communities. So we have to train our staff on how to communicate and how to use professional interpreters instead of using family members as interpreters. So if you're speaking with populations or speaking with people who do not speak English or who are deaf or hard of hearing, it's important to figure out how you're going to communicate with them in a way that will ensure that your message is getting across. Because sometimes family members have a filter and they don't necessarily always interpret everything, or they may not necessarily be as bilingual as we expect them to be and may not necessarily know how to interpret for us. So it's important to work with individuals who've been trained to be able to do that. In my past work, some of the things that I've learned is that it's important to attend cultural events, especially if these are events that I don't normally attend, so that I become more familiar with a little bit of the culture of individuals that are a part of these different events. Another thing that has worked is peer outreach. So thinking of it more as a partnership. So partnering with individuals who are from these communities and training them alongside with individuals who are not from these communities, and training in a way where we're not saying specifically this is what you do, but more so to provide a balance, because it may be more effective to have individuals that are a part of the population to also work with the populations that you're trying to reach. Another thing, collaborate with agencies that serve these populations already. There may be events that these agencies are putting on that you can become a part of. If you're a part of an organization that may attend a festival, or you could become a part of an organization that starts a festival. We used to offer test festivals when I worked at Project ARC to offer HIV testing, and it was a festival. So it wasn't just come and get an HIV test, but it was come and enjoy yourself, and we also have these additional services available. Lastly, I would like to encourage everyone to focus on the benefits. Sometimes when we talk about the penalties that can come, that may set someone off and they may no longer focus on what the importance is that you have to tell them. So try to focus mostly on the benefits, and if you do have to talk about the penalties for not enrolling, explain why. Okay, because there's a lot of misinformation about what's going on and why we have to make sure that everybody receives health care coverage.